We're live. Hello, it's Bill, the knee pain guru. Today is Tuesday, May 18th, 2021. Welcome. We are going to talk today about, I did a video yesterday on burning pain on the inside and front of the knees. And then we had Nikki, who had shared her feedback about a similar experience, but she's had partial knee replacements 2 years ago. So I'll read you what she wrote, and then we'll kind of tie them together because there's some important concepts that we need to kind of wrap our brain around in terms of getting some leverage for her. Nikki says, thanks for the video. I have burning over the whole knee and constant pain. I can't stand for longer than a minute. I had partial knee replacements 2 years ago. X-ray and MRI shows no concerns. I take an integrative approach to my health, which could mean an sundry of things. However, I eat healthy, drink water, and take supplements. Any advice would be appreciated. Well, we need more information. Like, it's vague. It's saying, I'm healthy, but I'm having these problems. So there's some disconnect between what you're doing and the results you're getting. We have to get to that place to go, oh, well, something needs to change in order to figure out how to get you the results that you want to get. When you're talking about constant pain, that's usually not true. Maybe constant pain as a baseline, but the pain is going to change on different things you do. If you sit, if you lie in bed, if you stand, if you walk, you're going to have a different experience. And what we need to do is begin to get an understanding of the distinctions and nuances of what you're noticing. Because in order for you to be in pain, there is awareness that is not lining up for what you're dealing with. And what we need to do is begin to get that awareness lined up with the level of pain that you're experiencing. Now, this ties into the next piece. When people ask for advice, suggestions, ideas, tips, and in order to this is not when you've had knee replacements, partial or full, you're talking about something that's been going on for years. Arthritis, which evolves to bone on bone, which evolves to getting a knee replacement surgery, does not happen overnight. This is a level of disconnect, a level of awareness, and it looks like I can't deal with my knees right now. I got to push through the pain. I'll deal with it later. Ignoring it. It's not so bad today. And this is a pattern of not only thinking, but how you treat your body that eventually wears away the knee joint that ends up in needing a partial knee replacement. And what ends up happening is this pattern doesn't change once you have a knee replacement surgery. We have to accept that this pattern has been going on for a period of time. And when we disconnect from what our body needs, either we don't know what to do, don't know how to take care of ourselves, or don't allow ourselves to take care of ourselves in a way that gets the knee out of pain, this is a disconnect that we have in consciousness, our awareness, that we need to begin to shift and change. So, first things first, and this is going to get into the fundamental approach to getting a knee out of pain. And it doesn't matter the diagnosis. It doesn't matter how long you've been in pain. It doesn't matter how old you are. This is where, when you work with principles, fundamental, foundational principles of how the body works, it's different than getting stuck in the diagnosis and saying, well, the doctor diagnosed me with this, so what exercises do I need to do? What tips do you have? What suggestions do you have? What advice that you have? And tips, suggestions, advice are like one-off. That it's like a shotgun approach, or throwing it against the wall and see what sticks. It's a waste of your time and everyone else's to only do like a little bit, like a little Dixie cup on a forest fire. It's just not enough. So we have to come in with changing the landscape of what you're dealing with in your knees, in your legs, in your body, in your life, that supports your body's ability to, one, feel comfortable by getting pressure off of the nerves. I spoke about the intrinsic movement in the knee joint. I spoke about that yesterday. And that's first and foremost. We have to teach your neurology how to be comfortable again. Then second is looking at the water that you're drinking, eating healthy. What does that mean to you? Because it's not the same for everybody. And how one person eats healthy is not the same as the next. And it doesn't necessarily mean it's going to work. How water you're drinking? How much water are you drinking? Is your body even absorbing the water? Supplements you're taking. What supplements are you taking? How often are you taking them? Are you noticing a difference? This makes, this could be the things that you're doing, that you're telling me that you're doing are right, could be the very things that are keeping you in pain. So we have to look at these aspects of what you're doing. Are you sleeping well? If you're in pain all the time, doesn't sound like you're sleeping well, which is going to slow down recovery. It's going to keep your body in a sympathetic state. So we need to look at all of these things and pick this apart and look at creating comfort. Then we got to look at these factors to support your body's ability to heal. Then we have to look at mindset. Are you, at the moment you start getting relief, are you going to go jump back into an activity that is going to throw your knees back into pain? That's a self-sabotaging mindset that many people have. And it keeps them in pain. It doesn't give the body enough time to heal. So we have to look at all of these factors to get you moving in a direction so your body can heal, so your body can get out of pain, so your body can recover, so your knees can recover. I mean, this applies to the entire body. We're talking about Nikki's knees and the 2 partial knee replacements that she's experienced. But once we start getting the baseline of comfort in your knees on a daily basis, we first bring down the level of pain so you get used to feeling comfortable, which is going to be a weird sensation at first. Working with a guy, Ed, out of Pittsburgh, bone on bone, calves and shins and ankles, everything aches, can't get on the ground with his grandchildren. And he's 2.5 weeks in, and he's already feeling his knees are greatly relieved, but it pops up in other areas. He's noticing tension and pain in his hips and lower back. That's because when the knees hurt so much, you can't feel these other parts of your body that ache. Your attention doesn't even go to those other areas. So once we get the pain level down, then we need to look at how this tension pattern that is resulting in your knees, just like the chain is only as strong as the weakest link, your knees are the weakest link from the head to the feet. Then we need to look at these other areas that are also pulling tight, that are going and contributing to the constant pain and the burning that Nikki, she is feeling in her knees. So we got to zoom out. We can't just look at a tip, a suggestion, advice. I mean, if you are, great. There's plenty of people out on the internet that you'll want to research, tips for knee pain. I'm not that guy. I'm looking for people who are committed to a long-term strategy. And many times when they commit to that long-term strategy, we can get a tremendous amount done in a short period of time because we're doing baby steps. Baby steps done consistently and correctly on a daily basis leads to exponential growth. Your body's ability to heal, get out of pain, heal, and recover in an amazing amount of time because your body is designed to do that. That's what it does. You cut your finger, your body heals. You break a bone, your body wants to heal immediately. You eat food, your body wants to digest it and use it to heal. So it's geared for that. That's all it wants to do. And if you're getting a result that doesn't look like what you want, there's something you're doing or something in the way preventing it from doing so. So we got a few people watching right now, a couple on YouTube. If you have questions, feel free to type those in the comments section. Give the video a thumbs up, like and subscribe to the channel, the Knee Pain Guru YouTube channel. Turn on notifications for future videos. If you want to know, like, okay, that sounds good. What do I do next? Go down below the video. There's going to be a link to the website. I'll put it right here. Get on my newsletter list. I'll send you emails each day that'll begin to shift your mindset in terms of how you look at pain. Get on the newsletter list. You can schedule a time for a consultation. We can figure out a strategy, like you're overwhelmed, not really sure what to do, how to deal with your knees. We can map out a strategy, whether it just be, conventional medical approach. You've got a diagnosis from your doctor, but it's like, well, what do I do with it? I don't want to go for surgery, or they're suggesting surgery. Are there other options? That kind of thing. We can look at everything that you're dealing with and map out a strategy for you. We could also look at a completely natural approach, which that could be maybe working with me, maybe working with a local practitioner by where you live. And there could be an integrative approach. You could take what the doctor said. You could take a natural approach, figure out what works for you. Because there isn't a template that works for everybody. No two knees hurt the same. Even two knees in the same body don't hurt the same. So we need to look at that. And I offer consultations for that. And then there's also working in my group coaching program. I call it Knee Club. We meet twice a week in a private Facebook. No, we meet on a Zoom call. There is a private Facebook group. We go over the questions that you have. I give you specific videos and a membership site based on how your knee hurts, how your knee hurts today. This is another mindset piece. A lot of people get stuck in how their knee hurt in the past, how their knee is going to hurt in the future, and they're not present to how their knee hurts right now. And when we get present to how your knee hurts right now, that's part of lining up the awareness of what's happening, and then we can begin to get results. This is part of the baby steps. You got to get present to how your knee hurts right now and what you could begin doing to get the pressure off of the tiny little nerves that are the width of an eyelash so you can get relief now, and then do that over and over and over until you teach your nervous system how to let go of pain faster. So it's a simple process. Simple, not saying it's necessarily easy, because the mindset gets into play. Well, I'm going to go play softball. I'm going to go to the gym. I'm going to go hiking. Anyhow, and it gets you back into pain. So that's what I got for today. No comments or questions came in. If you're watching the replay, feel free to chime in with any questions or comments. I usually use those on future videos. Share this video with your friends, especially the ones that limp. They're easy to see. And that's what I got for today. So, Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day. I will see you next time.